How is CMV and congenital CMV acquired? The virus itself is fairly not resistant, but prevalent. It can be isolated from urine, saliva, cervical or breast secretions, semen, blood, tears, etc., etc. During pregnancy, it has been shown that the likelihood of a mother who has a child with CMV acquiring that from her toddler is significant. Approximately 30% of 30% of mothers who were prior unexposed to the virus ended up acquiring that during that pregnancy time. That's partly because children who are less than 2 years old actually shed that virus in their urine and their saliva and their tears for sometimes up to 6 or 7 years. And what we see is congenital CMV clearly and closely mirrors the distribution of maternal seroprevalence. That means the greater percent of the population that have CMV, the higher the rate of CMV congenitally. In this map, you'll see that the darker shaded countries are those with the highest maternal seroprevalence rates, and consequently, the highest rates of congenital CMV. So how is it passed from mother to baby? Typically transplacentally. When we look at this, we see that approximately 1/3 of the cases of congenital CMV come because a mother acquires the virus in her pregnancy for the first time. We consider that a primary infection, and the rate of transmission is highest if that is how this is acquired. The bulk of the congenital cytomegalovirus infections, though, are secondary in nature, where a mother will have already contracted the virus and there's either a reactivation or a infection with a secondary strain that then leads to viremia and then transmission to the child. What you'll see in this interesting graph below, presented by a meta-analysis review from a group in 2020, is that as you go from preconception through the third trimester, this is in primary infections, the rate of vertical transmission, in other words, the rate at which mothers pass this to their children, decreases. It increases. It's low preconception, first trimester about 20%. By the time you're in your third trimester, it's nearly 2/3. There's an inverse relationship, though, with the fetal consequences and insults. Children who acquire or are exposed to the virus in the first trimester are more likely to be symptomatic, and those who encounter it later on are more likely to be asymptomatic or not acquire the virus at all. A number of risk factors that have been identified over the last 20 years for congenital CMV. Employment is important. Exposure to children and toddlers who are sharing their secretions puts one at higher risk. Daycare stands out. Those in healthcare need to be careful. Mothers who are younger in age at their pregnancies, mothers having the second pregnancy, and an interpregnancy interval less than 2 years are risk factors. Yes, blood transfusion recipients, transplant patients are at an elevated risk. Those who have non-monogamous sexual relationships, and then, of course, as we recently referenced, certain ethnic and demographic factors, including lower socioeconomic position, are risk factors associated with elevated incidences of congenital CMV.